Patient-reported outcomes are information that come directly from patients about the symptoms that they're experiencing with their disease and the impacts of those symptoms on their health-related quality of life. A number of years ago, we started asking patients with rheumatoid arthritis what was important to them in terms of their disease experience that they wanted their doctors to know about. And what we found is that certainly things like pain and physical function were important, but other symptoms like fatigue, sleep, mood disorders such as anxiety and depression, and how people would function in their general life doing activities and having social roles like being a parent, being able to participate in work activities. Those were also very important. And we realized that we were not asking people about those things that the patients told us really mattered to them. So about 7 years ago, we started collecting information through our electronic medical record system using a system called PROMIS that allowed us to look at all of these different symptoms that patients were telling us were important to them. And we started collecting that information on a regular basis in all of our arthritis patients, both with rheumatoid arthritis as well as those with psoriatic arthritis and ankylosing spondylitis.
In psoriatic arthritis, we asked patients what it meant for them to achieve treatment success, and if they did not achieve treatment success, to tell us why not. Patients told us that pain, fatigue, and stiffness were the most important reasons why they felt that their treatments weren't working. Patients told us that when they don't achieve treatment success, the main reasons for them were pain, stiffness, and fatigue. Interestingly, we noticed slight differences between men and women, where men were more likely to report that stiffness was the second most important reason for them, whereas fatigue was the second most important reason for women. We can only measure these concepts using patient-reported outcomes, so I think it's really important to continue to measure these.
So some of the work that I'll be presenting at this year's American College of Rheumatology meeting is looking at fatigue and how that responds to different treatments in clinical trials in rheumatoid arthritis. And what we found is that these PROMIS measures that we're using now in our clinical practice are very responsive in terms of biological therapies. So we can show that there are meaningful differences in levels of fatigue when people start certain biological medications, which for our patients is really something that they're looking forward to and something I'm very excited that we're able to offer to patients.
It's really exciting to see that PROMIS is taking so much ground in rheumatoid arthritis. I will be presenting how the psoriatic arthritis impact of disease measure responds to treatment in clinical trials in patients with psoriatic arthritis. And we see that this measure improves with treatment responses in patients, and also that patient-reported outcomes improve even faster sometimes than the clinical measures.
So that's the type of work that we have ongoing now, understanding how these patient-reported outcomes will change over time in response to different therapies and help us as predictive markers to help us in management of patients. One of the other things that I think is really important is that we conducted qualitative research with patients and with providers a number of years ago when we started using PROs. And what we found through these qualitative interviews that we did with patients and focus groups that we did with patients and clinicians was that the PRO information, when it was shared between doctors and patients, was felt to be very important in terms of fostering communication between patients and their physicians. It was also very important that this information could directly influence treatment decisions and could help people to understand that there were new problems that wouldn't otherwise be recognized. That is one of the reasons why we think these PROs are so important. Not only that they change, but they also make a real difference in terms of how people do.
I think this is very important work, getting to what is meaningful change for patients. We did something similar with psoriatic arthritis, where we validated the walkway between the older Health Assessment Questionnaire Disability Index and the PROMIS Physical Function Measure to be able to interchangeably use the minimal disease activity criteria, whether we use the HAQ-DI or the PROMIS Physical Function.
Yeah, I think it's really exciting how we are using these newer measurement tools and how they really do help us at an individual patient level determine how we are going to change therapy and how patients are doing over time.